Am I aware of it? No.
Mm-hmm. Okay. We're looking at the x-rays, and I'll take a look clinically, obviously, but I can take just one look at the x-rays and I can tell that there's quite a bit of wear. Those are two distinctly different habits, but they present themselves in the mouth very differently. If somebody clenches their teeth, they're bearing down on their teeth with a lot of force, the teeth start to splinter and you can see these little crack lines in the teeth. Sometimes patients come in and every single tooth has them. Sometimes patients come in and only a few teeth have them. Sometimes there's multiple crack lines on every single individual tooth.
Wow.
So that's a product of somebody who clenches their teeth. And very often the two habits come together. They kind of coincide. Grinding your teeth is going to present itself in a bit of a different way. It's like sandpaper. You're just wearing down the two surfaces of the teeth that are partners to one another. Now, some people, they'll come in for a cleaning or something like that 6 months down the road and they'll say, hey, it's funny, when you mentioned that to me, I started to pay more attention. And sure enough, I catch myself clenching and grinding during the day as well.
Wow.
So if somebody's clenching and grinding during the day, for sure they're doing it at nighttime.
Yeah.
But generally speaking, most people they only have that habit at nighttime. And so yeah, they have no way of stopping it.
I'm not aware of it. Yeah.
And I do have other patients who will say, well, that doesn't make any sense because I snore. My wife says I snore or something like that, right? Well, yeah, when you snore, your mouth is agape, but there are peaks and valleys throughout the night.
Right.
So you'll go through bouts of snoring and then you'll go through bouts of bearing down on your teeth and clenching and or grinding. So, the point is, if you're to do any sort of cosmetic work, it's important or critical really, that beyond that point of putting in all the crowns or veneers or whatever it is, that you are wearing a night guard to protect, just as you would protect your natural teeth, you need to protect the porcelain, obviously.